Hey everybody, it's Rukosa, the Boob Boss, and welcome to the very first live stream of my new show, Bumps, Babies, and Boobs with the Boob Boss. I'm Rukosa, a nurse practitioner and lactation consultant, and I'm so passionate about helping moms and just helping you and expectant parents just navigate the journey of parenthood. And part of that was starting this live stream. Before COVID hit, I have a lactation and parenting wellness clinic called The Perfect Push. And before COVID hit, we're doing so well, and we were slated to open a new wellness center in 2021. Then COVID happened, which I'm sure it's been happening to everybody else. That is the story. And I started thinking to myself, so how do I still get the message? How do I help new parents out? And I was like, hey, when the world gives you lemons, go live. So here we are. And today we're going to be talking about switching to a birth center. That is the number one question I've had a lot of our moms asking us. Do I need to switch to a birth center? What is that going to look like? What is it like delivering at a birth center? And I was like, you know what? I know two of the most amazing midwives in Seattle. So without further ado, I want to introduce you to Christine and Angela with Eastside Birth Center. Hey, Chris.
Hi.
Welcome to Bumps, Babies, and Boobs Live. Thank you so much for being my very first guest.
You bet. We are both really excited to be here.
Yes, thank you so much.
Yes.
So I want you guys to go ahead and introduce yourselves and just let us know who you are, because you are the founder. So we have a founder in the house, and I'm all about my boss babes out there. So Christine, tell us about who you are, and then Angela, I'll have you introduce yourself next.
Well, I'm Chris Thane. I have been a midwife for going into my 25th year. I have owned a birth center up in Kirkland for a while, and then came down and built Puget Sound Birth Center, Eastside Birth Center, and have been delivering babies and delivered over 1,000 babies over the years. And then I've got my girlfriend, Angela, here, who came on board with me and has been with me for about has it been 3 years, Angela? 4 years now?
4 now.
4 now, woohoo! Time goes by when you're having fun. And we've just been really trying to help every mom and baby. Like Angela says, we're saving, what do you say, Angie? What's our motto, our new motto?
Changing the world, one mom and baby at a time.
There you go. I love it. So, is there anything more that you wanted me to tell you, or that?
No, I love it. 20 plus years. That is amazing.
Yeah.
That is absolutely amazing.
And I still love my job, and I don't think everybody can say that about their job. It's like, I've got the greatest job in the world.
Love it. Well, welcome. So good to have you, Angela.
Hi, I'm Angela. I started my journey to midwifery back in 2011 when I moved to Portland to attend birthing my College of Midwifery. I moved back up here to Seattle because that's where my family is, and met Chris at the end of my midwifery training. And we have been together ever since. And now that I'm a practicing midwife, we are here doing this together, and it's a lifelong thing. Just like I said a second ago, changing the world one mom and baby at a time.
I absolutely love it. So I wanted to start by telling everybody like how we met, because Chris kind of saved my tail in the out of birth community. We were at a baby show, and Chris came up to me and she goes, "Oh my God, I want to know more about the Perfect Push. You guys have doulas." And she was so excited to meet me and talk to me. And she goes, "So, what do you guys do with birth centers?" And I said, "Oh, we don't support out-of-hospital births." And Chris's eyes were like literally about to pop out of her head. And she said to me in like total dramatic, she goes, "A dagger to my heart." I'm like, what did I say wrong? And she goes, "What do you mean?" And I was like, "Oh, no, hold on." And Chris, it was so amazing to actually have you correct how I was speaking, because it wasn't what I meant, but it was how I said it. And it seems, especially coming from a medical provider and one who takes care of pregnant women, the way that I said it came across as if I didn't support birthing centers or home births. And I'm going to let people explain how you explained it to me. But basically what I was saying, as the perfect push, I'm a career labor and delivery nurse. I've worked in high-risk hospitals, in very intense settings, and that's always been my place of comfort. And I mistakenly thought, before I'd even had this conversation, Chris, I'm like, you're delivering with a midwife at the birth center. What do you need a doula for? Like, I mean, you've got Chris, you've got Angela, you don't need us. And you were like, oh no, we need you. We need you in the birth centers. And I was just saying, most of our area of focus had been in the hospital because I thought that's where women needed doulas. But you came through and said, hold on, Ruth, firstly, don't say that ever again. And I've never said it again. But you really educated me on the role of, you know, what a doula is in a birth center and what the role is and what your role is as well as a provider as well. So can you elaborate a little bit on that?
Well, I think what I told you is, you know, women need doulas, in my opinion, whether they're in the hospital or out of the hospital. Even when I had my son, I hired a doula, and I'm a midwife. So I think doulas are amazing. And I also think that, know that our women also need a lot of lactation support, which is what you are amazing at. And that's partially why I was so tickled when I heard about you, because I'm like, I need a really good lactation consultant, because boy, when those mamas need help, they need it yesterday, right? And to have somebody that can really sit with them and hold their hand and help them through those things, because obviously as midwives, we think breastfeeding is very important. So I was really kind of going, wait a second, trying to make you back up and think to yourself, wait a minute, these are pregnant moms. It doesn't matter location of where they deliver, they really need the support in both those areas. So I think I said, we need to go to lunch.
Yes, and we did end up having lunch. So,
yes.
And now look at where we are. And, you know, I just love it. And this is what I love about the Seattle birth community. Just for us to be able to create this world where now if I need anything, I'm like, hey, Chris, I've got this patient I think should be a great fit for the birth center. And we get to have our first delivery together this coming up next month.
I know. I'm so looking forward to that.
I am totally so ready for this. But yeah, it was really, really nice for you to actually ask me to take a step back, because I think sometimes as providers, especially in a hospital setting, you can really unintentionally steer a patient away from an option, and this is part of the reason why I really wanted to have you now, because with COVID, suddenly all my patients are asking me, okay, Ru, can I go to a birth center? Should I switch to a birth center? What does that look like? So I really wanted to make sure that we could dig deep into that. But before that, we know about 93% of women deliver in the hospital. But should that be the statistic that we have out there? Like, should it have taken COVID for us to really start looking at our out-of-hospital birth community and saying, hey, what's going on out there? What do you ladies think?
Yeah, why don't you take this one, Angie?
Yeah, actually, it shouldn't be a statistic that large. We feel that low-risk, healthy women are better outside of the hospital because in some cases, just by, walking in the hospital door, just by going in, you're increasing your risk of a C-section by the cascade of interventions by, 30 to 35%. And so many of these women that have healthy pregnancies, low-risk women coming in, with no pre-existing health, conditions, can deliver with us without that whole cascade. And the other climate about this for a lot of women is the story of once a C-section, always a C-section. And that shouldn't be either. So a lot of those women that had their first C-section also maybe didn't have to have one if they were birthing in a setting like this.
Yeah.
Awesome. And we have Malia just put on a comment, and she says, we had the best experience with Angie and Chris and everyone else at Eastside Birth Center. So thank you for that. It's great to know.
Thanks, Malia.
Thanks, Malia. That was an amazing, amazing birth.
So, tell us a little bit more about who is a good candidate for delivering in the birth center. So what are we looking at? Because yeah, right now we have women all the way up to 36 weeks pregnant, 39 weeks, calling and saying, can I transfer? What does that look like? Who is a good candidate? Who should be considering this?
Well, certainly they need to be low risk. Everything needs to be normal within the pregnancy throughout. Certain things like if someone's diabetic and on insulin, that's not something that we can take on. If somebody has high blood pressure, has any heart conditions, there's certain things that just put them in a slightly higher risk category that makes them not safe to be outside of the hospital. In those situations, they need to be in the hospital. But the majority of women are normal, healthy, pregnant women. And so when they come in for their initial visit, what we do is go over their history thoroughly to make sure that there isn't anything that would not qualify them to be out of the hospital. And certainly there are times when things come up, like they come in and they're diabetic or they've had a heart condition. I've had people come in and there's been a few times where I've sent them to a cardiologist to just determine whether what they had as a child could potentially be an issue. But as long as they're normal, healthy, pregnant moms, we will take them on. Now, someone that's coming in late in pregnancy, I don't like to take someone too late, just because I want to make sure that we have an opportunity to get to know them and they to get to know us. We've taken people at 36 weeks or so. But I like to see them sooner if we can. But you're right, Ruth, some people are calling fairly late right now. And so I've made some exceptions in how late I'll take somebody, just because there's this last minute, oh my gosh, I'm being told I can't even have my doula with me when I go in. Or I think most of the hospitals at this point are allowing at least the husband. And that's it. No one else is allowed with them. And that's partially what has been challenging those moms out there, is they have their doula and their support team that they really want to have at their birth. We are certainly trying to limit the number of people in the labor room as well, just because we have to try and protect ourselves and make sure that we're doing what we can to stop the spread of this virus as well. So is there anything you can think to add, Angie? That I think I hit it.
No, you did a great job. There are things that also come up that for our late transfers, for instance, if you know your baby's in a breech position, that would not be a time that you would want to come to us.
Yeah.
So there are things that come up last minute too that maybe you didn't know ahead of time, like those blood pressure issues that creep up in that last month of pregnancy. So people can start care with us.
Yeah. Sometimes we have to transfer you back into a hospital setting like that. Yeah.
So and it's hard to.
Go ahead.
What does that look like so I come in, I'm, working with you, I think absolutely amazing, everything is going well, and then I have to transfer back to a physician. So what is your recommendation? Should a patient have a physician relationship already, obstetrician relationship already established? Or is there an particular obstetrician you guys work with? How does the whole transfer process work?
Yeah, normally what we do is we call and talk to some physicians because we're so close to Overlake. That's commonly where we'll call, though I do have a couple of relationships with other OBs in the community that sometimes I'll call and ask if they'll take them on. Because if we do have somebody that, like we were talking about, suddenly becomes preeclamptic, or their blood pressure elevates to the point where it's really not safe for them to be out of hospital because they are becoming what is called preeclamptic. In that scenario, that would be something that we would transfer them in. But we get that lined up. We don't just go, oh, gee, sorry, you got to go. We basically would get them connected with an OB and get them into the care that they need to try and, shift their care back to the hospital if that was needed. Thank goodness that doesn't happen very often, but it does.
If they do end up having to deliver at the hospital, what's your relationship with them from that point on? Do they come back to you for their postpartum care?
Yes.
A complete switch, and then it's like, how does that work?
Yeah, absolutely. We tell them when they go that they're not rid of us and that they need to call us the second that baby's out. Commonly, we're talking to them and finding out where things are, when they deliver, and we'll sometimes go out and do a home visit for them if they leave the hospital, if they're trying to leave sooner rather than later, and we definitely encourage them to come back, because a lot of times those patients will look at us and go, well, is that it? We're not going to get to see you anymore? And it's like, no. Yes, you are absolutely. You have not gotten rid of us that easy. And so we have them come back and we do their follow-up postpartum care and take them right back under our wing, because we hate to lose them. That's for sure.
Awesome. Well, I have to pause things for something really important, because somebody thinks you are absolutely gorgeous. I don't know. I think that last name thing is kind of a giveaway.
That is my husband. He's obviously at the office watching.
So I don't know what my husband is doing, but I know, honey, you might want to get online and say something really quick. That is so cute. I had to bring that up there. Talking about husbands, we have a comment here from Shazek who says, also, what happens if my husband is anxious and wants to go to the hospital? So what do you guys do when you're like, I got this, but dad is like, can we go now? Like, okay, we just need to go. We need to go. So what do you guys, what happens, and how do you navigate those situations?
So in that question, I guess part of what I'm wondering is if they're talking about when the mom is in labor, or are they talking about in trying to make the decision whether they deliver outside of the hospital or in the hospital. If it's prior and trying to make the decision, because it sometimes is the mom really wants to have a birth center delivery, but the husband is feeling really concerned, because I kind of see those husbands as our protectors, right? They come in and ask all the technical questions. What happens if something goes wrong? And what is the plan? And the moms come in and ask the more warm and fuzzy questions of what's it going to be like when the baby comes out and things like that. So for if a husband is questioning it, my feeling is trying to make them be part of the prenatal care during the care is really important, because then that kind of, we can create that relationship with them and answer all those hard questions, and then try and gain their trust. If they're not part of that prenatal care, then they don't get an opportunity to kind of learn about how things go. If it's during the labor, I don't think we have husbands suddenly say, that's it, I can't, I want to go. It's not like that when someone's in labor. If there's things that come up throughout the labor that they say we get stuck, we're at 6 centimeters and we have tried everything and mom is not progressing. Everybody, the husband and mom, are both part of the process. They know what we're thinking. We would say, okay, I don't generally pull the carpet out and say we're going. In a non-urgent scenario, I would say, we've been at 6 for quite some time. I would like to try getting her in hands and knees and doing this and try this and this. If that doesn't work, we're going to check back in the next hour. And if we still haven't progressed, then we're going to look at going to the hospital. So I think dads really feel like they have some control and are part of the decision-making process. And I don't feel like I have dads panic during labor, thinking, every once in a while you get a dad that's worried, certainly, but we're talking to them and they're part of the they're part of the process. We're not doing things to them. And if that makes sense.
Yep, makes total sense.
Yeah.
And I wanted to make sure I asked you guys this, because this is a question that came up, especially with anxieties. I did a doula meet and greet with a family on Wednesday, and they were like, okay, so, what is the difference between a doula and a midwife? And I was like, huge difference. But I was like, tune in on Friday and you're going to find out, because I have 2 of the most amazing midwives to answer that question for you. So what is the difference between a doula and a midwife, and how does one become credentialed to become a midwife? So what is your training? What does it entail? What can you do and what can you not do?
Good. You go, Angie.
Sure, absolutely. Well, a midwife is your care provider, right? So they're responsible for your clinical care. A doula is your labor support person. So they're there to provide comfort measures, all of the good hip squeezes, counter pressure. They kind of are your advocates where if we're explaining something in a medical way, they are really great to put it into terms that the mom can understand. In a birth center setting, particularly, we have women come in when they're in active labor, and we know that early labor, particularly the first time around, can take a long time. And so that doula is providing support to them at the home before they even come into the birth center. So they're with the family from the home through the birth process. And then afterwards, I also have postpartum visits. And we also do really great labor support. We are excellent at hip squeezes and counter pressure and all of those things. But when the time is getting close and we're pushing and all of those things, honestly, the comfort measures to us take a second seat to your clinical care and listening to heart tones and helping you push and all of those things. So it's really nice to have somebody that can do all of those things the whole time. It's also a really nice person that can show dad how to do those things and how to support their wife. So those are kind of the differences. We're responsible for the care of your pregnancy, getting your baby here safely, and your doula is your rock star labor support person.
Right.
And so
Along with
doulas
the
don't have
partner.
medical training, where as you guys are medical practitioners, right?
Yes.
So what is
Right.
the credentialing? Chris, what is the credentialing to become? What's the process? What do you guys have to go through? I know when people think about, they're like, okay, a physician went to medical school and you did XYZ. You have certified nurse midwives. They went to nursing school, went to grad school, and then did XYZ. So what does it mean for your credentials? LMCMP, what does that all mean?
Right. Well, in order to get into midwifery school, you have to have 2 years of pre-med type prerequisites. And then it's a 3-year program to become licensed in this state. And then you have to be involved in 100 deliveries also to be able to be licensed and sit for a board exam here in Washington State. At least that is what is required in this state for a licensed midwife. And so I did my training with Seattle Midwifery School that actually is merged with Bastyr. And then I actually did a stint in Samoa. I got to do some births. I did a stint there for a month when I was training and got to deliver 88 babies in Samoa, which is pretty cool. But then once I graduated and took the licensing exam, then opened up a birth center and started practice.
Awesome. Yeah, I think that's probably one of the biggest misconceptions. People don't quite understand what the difference between a doula and a midwife is. So I hope everybody else, out there has got that. Licensed midwives are your medical provider, and your doulas are really there for your emotional, for the additional emotional support. Which again, after I talked to Chris and got an idea of exactly what's going on at the birth center, she was like, "Well, hold on. Like you, I am a provider." So it's great to bring in the whole team so we can really make sure that moms get the full experience. I know one of the things that I definitely want people to get an opportunity to see what Eastside Birth Center looks like, because it is beautiful. So we're going to bring up a picture so that you guys can see it, and then we'll talk about it. Like, who doesn't want to have a baby there? Like, seriously. Isn't that absolutely gorgeous? So, I mean, yeah, look at all that. Absolutely amazing.
My husband and I jokingly say what we need to do is start telling people that they can come in and conceive there and deliver there.
One-stop shop.
That's right.
No, it is absolutely beautiful. And I think one of the things that we've tried to do with the Perfect Push Clinic is not make it feel so sterile and so clinicky. And when I see birth centers, I am a bed and breakfast type girl. I love bed and breakfast. And that's what it reminds me of. It's just like a place where you want to go and you don't ever want to leave. So I'm like, can I just move in? Like, can I stay for a month after the baby? Have you guys wait on me? Like, what does that look like? But it was absolutely gorgeous. And I think it's such a beautiful way to really deliver and feel like you're at home. So do you support home births? How does that work with you guys having your birth center? What role do you play in the home birth world?
Absolutely. We love a home birth. We do both birth center and home births. We give that as an option to all of our people considering coming into care with us. And what we have sometimes is people starting wanting to do a birth center birth because they're not sure about things. And then by the end, just come to a prenatal visit and say, hey, we changed our mind and we would like to do a home birth. And all that is for us is changing the venue. We love doing home births. And
I was just going to say, tell them we carry the same equipment.
Okay. Absolutely. All the stuff at the birth center, equipment-wise, we have in our cars with us all the time. The oxygen tanks, the medications, all of those things, all of the monitoring equipment. The only thing that we don't bring to the home setting that we do have at the birth center is nitrous oxide.
Right.
Oh, let's talk about it. So, I told Chris, I'm like, if I can convince the husband to have that third baby, I'm going to have it at a birth center.
But it has to be one that has nitrous, if I recall.
It had to be exactly. And I was like, Chris, do you have nitrous? And I'm like, I'm sold. That is it. And I was like, and we're going to film the whole thing. It is going to be live streamed while I with nitrous. I can't imagine me and nitrous oxide. It's going to be hilarious. So yeah, birth centers do have, and this is one of the things that not all the hospitals, I think it's only the UW right now that even offers nitrous the last time I checked. So tell us about nitrous oxide. This is something that's been done, across the pond for a long time. Tell us about nitrous oxide. Is it safe for women? Laughing gas and having a baby. How does that all come together?
It's actually been shown to be very safe because it's quick to be in and out of the system. So what it does is has an effect of really helping women just kind of relax. And that's the key to labor in my thought process is whenever you're in pain, you have a tendency to tighten everything up. And the key is through labor is to get someone to really try and, instead of tightening up against the pain, to release and soften with the pain. And so the nitrous helps women do that. It helps them soften and relax things. And I've had it save several women that have been in labor that, are hitting that wall of 7 centimeters and they're really struggling to relax. And I can think of one in particular that was like, I want to go to the hospital. And I said, okay, I hear you, but how about we try the nitrous? I really think it will help. And if that doesn't work, then we'll go. And she got the nitrous on board. And it was the difference between night and day. It's like her bottom just softened right down. She didn't pull up with those contractions. And we had a baby about an hour and 15 minutes later. And it was a beautiful birth. And she was so happy after. Because she said, you hung with me and you told me I could do it. And I said, that's right. She goes, and that nitrous, I like that nitrous.
You do, right?
Yeah.
It's like a magic combination of the mild analgesic and the anti-anxiety, that anxiolytic property that it has, the combination of the two together. We're never going to tell somebody that nitrous oxide is going to take away the contraction pain, you know what I mean? Or the intensity of the sensation. But what it will do is it'll take the edge off a little and it will help you come back down to ground zero so that you can cope again.
Yeah.
It's just a magical combination.
Yeah.
And it really does get women through to the end.
Yeah.
Well, I'm a flat out hot mess. I am even more, yes, it's going to be dramatic. And then, so I am excited. If we can convince the husband, I'm super, super excited. We have a great question here. Will insurance cover a midwife and birthing center? So how does the whole payment system work? Is it more cost effective to deliver in a birth center?
Yeah.
What do our parents out there need to know?
Yeah, we are covered by almost all insurance companies, and yes, it is more cost effective. Unbelievably so. I'm amazed because our care, I think, is so much better. Well, it's not better. It's just that I think it's more personalized care when you're seeing a midwife, right? And so it's more cost effective because the overall cost is less. So if you have a plan that covers at 80% or 90%, you're looking at paying 90% of, if you're doing a birth center birth, for the prenatal care and the facility fee, the total cost is $6,500. A hospital setting is, for a normal vaginal delivery, can be anywhere from $15,000 to $20,000, depending on if an epidural is placed and all of that. So if you're paying, 20% of the lower number, right, it's going to be less money than it is for that upper number. But we are contracted with all the insurance companies, most all of them. So it is covered by insurance, which a lot of people are surprised by.
So you run insurance up front, or do people need to pay and then get reimbursed? How does that work?
No, we bill. What we do is when someone comes in to start care, we actually go look into their plan and then give them an estimate of what their cost, what their portion will be. And then we have them pay their portion and we bill out to the insurance company for them. And they can figure out a payment plan however they want to pay. If their total cost is $500, then they can pay that over the course of their pregnancy, or they can choose to pay that by 32 weeks, I think is what we give them generally. And then if there's any kind of a difficulty, we will always work out some kind of a payment plan with them.
Yeah.
Awesome.
Yeah.
Awesome. And then, do midwives provide routine GYN gynecological care beyond the postpartum period?
No, as a matter of fact, that kind of is a bum deal that I think as midwives, we've been working on, I think, is trying to being able to do that extended care, because we can do pap smears and things like that, but our licensure allows us to see women up through 6 weeks postpartum, and we aren't able to do well women care. So at least not for a licensed midwife.
And how does that change with the baby? How long do you see baby? Because I know when you send babies to our lactation clinic, a lot of times I'm sending reports back to you, but then at some point I'm having to send to a pediatrician as well. So how does that work with how long you take care of baby as well? And I definitely want to make sure that our viewers out there know that they do home visits after you've had the baby at the birth center. So they're going to come to you, which if I could change anything in this world, that would be it, is not bringing deliriously tired parents out of their homes and driving from one place to the other. But just because of what's our highway? 405?
405.
405,
520, all of them.
It's all of them. It's a riot. I-5.
Yes.
It really makes it hard for practitioners to get one place to the other, but midwives still go to the home, which, I mean, hats off to you. I absolutely love that. But tell us how long you care for the baby.
Yeah. So we definitely do come to the house 24 to 48 hours after that baby's born. We do the critical congenital heart defect screening, the first newborn metabolic screen, which is the 2-part test. And then we see baby again in the office. But scope-wise, the care that midwives can provide to newborns in the state of Washington is the 2-week time period. So, in a normal scenario, we care for the baby, which after the baby comes, we're still on call for you guys. That's another thing. It's not that we're on call for you until baby comes and then we're not. We're on call that whole time for the postpartum period as things come up. So in a, uncomplicated normal scenario, we take care of that baby for the first 2 weeks, and then they see the pediatrician for that 1 month well baby check. As I was starting to say, they come into the office where we do the second newborn metabolic screen. We check their weight, make sure that they're gaining appropriately and back to their birth weight by that 2-week mark, which we want to see how nursing's going, see if we need to employ other awesome lactation help like you guys, if we have, a mom and baby dyad that are having a harder time. So the quick answer to that question is we take care of babies for 2 weeks, then they see the pediatrician at the 1 month mark.
Awesome. Love it. And we have Brianna. I love working so close to the birth center, seeing how they are with patients confirms how much they rock. The beautiful connection is amazing.
Aw, thanks, Brianna. uh,
So yeah, now with how has COVID affected the birth center? So what would you say you guys are doing differently? I'm sure, with the number of patients I've had calling me asking about you, I'm sure the demand has gone up. Are you waitlisted? What would you say to the mom who's 16 weeks and watching and thinking, okay, do I need to get in now? When is the perfect time to start thinking about coming to a birth center, approaching you guys?
Well, I'm thinking sooner rather than later, always. Like I said earlier, I really like to establish that relationship with clients and for them to get to know both of us really well. And so, there's no time too early. I oftentimes see moms call and say, well, I tried to get in with the OB, but they won't see me until 12 weeks. And I'm like, no, let's get you in here at 4 weeks, because there's so many things to talk about in relation to their nutrition and how they're eating and what supplements they're taking, and dealing with nausea if they're having issues with that. And all of that kind of gets missed if they're not seen through that first trimester. So I'm a big fan of getting people in sooner rather than later. But in terms of the COVID situation, if someone it is that question, how are things going to be changing over the next few months? And yes, we have had an influx of patients calling and transferring in. It hasn't been to the point where it has made us have to cut people off yet. Our June is fairly busy, but I think we still have room for another one or two. But we're still pretty open. It hasn't been quite the influx that some of the midwives as a community, all of the midwives in the community were a little bit worried about. Were we going to be over inundated to the point where we really couldn't help everybody? It hasn't been quite that. But it has been definitely, we've seen an uptick because we've had clients coming in that are worried about that hospital setting and also wanting to have their doula with them. And so they don't want to do the hospital because they lose that, the ability to have that. And then in terms of what we're doing, we are actually doing a lot of telemed visits at this point, which as much as I kind of hate that, Angie and I are both feeling disconnected to the babies because we don't get to put our hands on them in mom's bellies. So that makes it a little bit difficult, but we're trying to keep everybody safe. And so we're utilizing the telemed applications and doing that for some of the visits. But there are certain visits that we need to see mom, like if they need to come in for their initial visit so we can draw labs and things. And then for gestational diabetes testing at 28 weeks, if they're doing that, they need to be in. And then the last 4 weeks of their pregnancy, we see them every week because those are really the critical times to be watching fetal growth and things. And so we're wearing masks. I know I hate that. I feel like people can't tell when I'm smiling, but I hope that they can see that my eyes are smiling.
It's amazing. They can see it in your eyes.
Yeah, because it's like all they can see is my eyes. And we're wiping surfaces down. I've washed my hands so many darn times. I tell you, I feel like my hands are so dry. But we're doing those types of things, and then trying to limit the number of people that come to the prenatal visits, unfortunately, asking if people can hold from bringing their kids with them, which is not the norm for us. We welcome children into the office. Normally we have a place, a toy box for them to play in and things like that, but we've had to load the toy box out of the office because we don't want kids playing with things within the office, and trying to keep kids out of the office and limit the number of people if we can. Though I still think those husbands need to be there. So I still encourage them to bring their husbands with them for sure. But to try and limit bringing a huge group with them for their prenatal visits.
Yeah, and I think that's why, and I am at heart, career labor and delivery nurse in a hospital, and I absolutely understand why hospitals are taking the precautions that they have to take.
Oh,
Just given
absolutely.
the size of hospitals, this number of staff that you have in the
Yes.
hospital setting, and as a nurse and watching my nurse friends go to work, and I can imagine if I still had to work on the unit and having to field people coming in and out, and then coming home to my own babies and thinking,
Yeah.
wow, if we could just have less people, I could, do my job as well as care for my children. So I absolutely get what hospitals are doing, and
Yes.
they're, doing everything they can to keep so many people, just because of the volume, so many people
Well,
safe.
their volume is so much greater than ours. We
Yep.
are a small practice, right? So
Yep.
yes, I totally understand the predicament that the hospitals are in right now. It makes sense. They have to do this, right?
Yep.
They are also dealing with people that are sick with the COVID. I mean, I did talk to an OB the other day that had a mama that was sick with COVID and in labor. And so they're seeing that in the labor and delivery rooms on rare occasions, I'm hoping. And they're dealing with the sick. If somebody actually came in with a fever, or was sick and was in labor, it would probably be something we would take them into the hospital to try and get them cared for there versus being with us. That would be something that would probably land them back in the hospital as well, if they were
Yeah.
positive for COVID, right?
Good.
Yeah.
Yeah, I think that's one of the beauties of, the birth centers, and just having that smaller place. It's easier to manage, easier to contain what's going on.
Yeah.
And so you can have more support people.
Yeah.
So yeah, I absolutely love it. And it's an option for our moms that are watching and wondering, what should I do? So if you are that mom who's low risk, no complications, definitely you want to reach out to Christine and Angela. And see if you can get on their books before they fill up too quickly. One of the things that I know right now I am, concerned about is, what is insurance coverage going to look like? Because we have, we don't know what we don't know, especially with televisits. How are they going to be covered? And GJ Mathis asks, have you seen a change in insurance coverage for home births with the COVID pandemic? Are plans that usually don't cover home births covering them?
Most plans do actually cover home birth. It's rare that they don't. There are a few plans that don't, but it's pretty rare. And it always frustrates me when they say no to that, because my thought process is, you have the same providers, the same things at your home. Why would you want to pay more and make them come to the birth center? But I have not seen insurance plans that didn't cover home birth say that they will cover it. Certainly an exception could possibly be made, and you can fight to try and get that, because I have seen clients that have had plans like that where they will not cover home birth, and they've petitioned their insurance company and actually got it approved. So there are times when it can be dealt with, but most plans do cover home birth or birth center. I haven't seen a lot of plans that don't cover home birth.
Awesome.
So
Awesome. And then with regards to once a woman has her baby, I know you said they get into the birth center, tend to come in, once they're in active labor. But how soon do you guys discharge them home? What does that look like? What happens to the mom who's like me, who's like, can I just move in? What does it look like for moms after they've had the baby?
Yeah. So in a non-complicated scenario, our textbook birth, we're sending families home at that 4 to 6 hour mark. And the idea of that is, we know babies have that alert period for all bonding that happens. And then they go into that long nap that is hopefully going to last 4 or 5 hours or so. And then they come out of that, and the every 2 to 3 hour feeding start. And we want that family to be home in their own bed for that big long nappy, because that's where recovery and all of that happens the best. So we get you home, have you tucked in bed after a meal, and then we say, we hope that you are still in bed when we come to visit you tomorrow for your 24-hour home visit.
Right.
And then if anything comes up, we give them very specific postpartum instructions. We're sitting there before the family leaves. I'm sitting on the bed with them talking about A to Z for mom and A to Z for baby. And after every section is a bold line that about this topic, this is when we want you to call us. About this topic, this is when we want you to call us. And then we're still
I was going to say, and we give them it all in written. We have a book that's an instruction manual for babies and new moms, because we know that when we're giving some of that information out, people are tired. And sometimes I think that we're sitting there going through it, and I swear they're probably hearing wah, 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 wah,
exactly.
wah. So we'll say, I know Angie and I both will say, okay, I know some of this you're going to take in, and there's going to be other parts that you forget. So all of what we're telling you here is written in this little book that we're giving you. And when you wake up from that nice long nap and you're more alert, you can read through everything.
Yes.
But then again, we're reachable 24/7. So if moms have anything that come up that they're worried or concerned about, when they call into us, they just get us directly, because our system just puts it to whoever's on call, Angie or myself. So
yeah. And if we need to come right over, then we come right over.
Yeah.
Awesome. Well, ladies, any final thoughts? Anything else you want to tell us about Eastside Birth Center, which is in Bellevue, Washington, just down the road from Overlake Medical Center? What is the one thing you would want to let a expectant mom or family who's considering coming to a birth center, what do you want them to know about you, Chris, and Eastside Birth Center?
Well, I think that, like I said a little earlier, the difference between midwifery care, I think, and care in the hospital is it's definitely a little more personalized care, because each of the prenatal visits, when people come in, we spend a full half an hour talking, and they have our undivided attention for that period of time. We also, gosh, I just lost my train of thought. So all of the same type of prenatal care is available with midwives as in a OB's office, because we offer all the same lab work that is available in an OB's office. We also send out for ultrasounds. We have a really great working relationship with Eastside Maternal Fetal Medicine, which is a perinatology group that does our ultrasounds for us. And so we're doing the same visits in terms of care, and offering the same lab work, et cetera, that the OBs do. It's very similar. It's just we have a lot more time to spend with each individual client, because we don't have as many deliveries as those OBs do. They're a heck of a lot busier in terms of they've got a lot more clients, so they're running in and out in 5 minutes, right? Anything else you can think of, Angie?
No, you did a great job. That's the thing about it, is we just get to know the family really well. We're part of the family by the end of the whole journey together.
And the birth itself, I mean, I hate that 6-week visit, because when those moms are done delivering, it's bittersweet, because you kind of feel like you really become connected with these moms, and then you have that 6-week visit, and you kind of have to go, okay, I'll see you when you get pregnant again. And sometimes I'll go, call us, and we'll have lunch. Because you do. How can you not be bonded with a woman that you just went through that experience with? It's like you're bonded for life, in my thought process.
Absolutely.
So yeah, it's really a connection that you make with clients, and getting to be part of, I got the greatest job getting to be part of delivering their babies. I mean, I'm on a high for days after a birth, and I sometimes need a birth fix,
Yes.
We have a lull. I'm kind of like, okay, we need to have a birth.
We need a baby. Are we getting a baby tonight?
Yeah.
We do call each other sometimes and say, are we getting a baby tonight?
Yeah.
Tonight going to be a night?
Yeah.
Angie, what are your final thoughts? What do you want people to know about you as a midwife, and about the amazing Eastside Birth Center?
Well, I just feel lucky to be a part of Eastside Birth Center and to be doing this with Chris. Honestly, this has been like better than I could have imagined when I sought out to be a midwife. I think Chris really nailed it on the head in describing the birth center. We just love it so much. It's worth it every single time. The long hours, all of it, every single time. It never gets old. And we welcome everyone to come and, tour the birth center. If you're still skeptical and have questions, come and meet with us. You can tour the facility and walk in, and we'll answer all of those hard questions that you have, all of those hard questions that your husband might have. So we're here for you guys. We want to the best birth experiences that you can.
Yeah.
Are you offering virtual tours right now because of the COVID pandemic? How's that working?
Yeah, I actually have a virtual tour. I'm working on getting our new website up, and on that website there is a virtual tour. I actually, how you see in real estate, where you can like step into the room and you kind of move the cursor and be able to rotate around the room.
Right.
And I actually have that in place. We just haven't gotten the website up and live. But if there's anybody out there that wants to see the virtual tour, I can send the link, and someone could take a look. And then we also are doing consultation visits online where we'll Zoom with people and answer all of their questions. I just did one of those from home today, which is awesome. That kind of works out nice sometimes, that I don't need to go into the office. But it is available to do virtual things because we are trying to limit the number of people we have coming through. So we've had actually quite a few. Angie and I have gotten together and actually done a few of the consults with people online just to answer all of their questions and things. And it's worked out really, really well. So yeah.
Awesome. Well, ladies, I cannot thank you enough for being here today.
You're awesome, Rue.
No, you guys are amazing. Thank you for signing on to all my madness and jumping on to do the very first episode of Bumps, Babies, and Boobs. We pulled it off. So yes, we did it. Thank you, Chris, Angela. I'm so honored to be part of such a robust birth community. I hope that we've been able to educate people out there on what licensed midwives do about Eastside Birth Center, which truly is a beautiful space. And all the moms and dads and parents and, expectant parents who are considering looking at birth centers and now looking at their options, please, please, please check out Eastside Birth Center. It is absolutely beautiful. And then we want you to tune in next Friday.
I'll be there.
Yes, we're going to be giving you better be.
That's right.
We're going to be back next Friday, May 8th at 7:30. And we're going to be giving away a free Perfect Push doula experience. I am going to be talking to Mariah Fallon, who is the president of PALS, which is a doula association based here in the Washington area, as well as Jen Hamilton, who is our director of doula services. And you will be able to enter in to win a free doula, a $2,500 value from the Perfect Push. So I hope to see everybody there next week. Ladies, thank you so much for being here today. Oh my God, I almost forgot. Y'all have a giveaway as well.
That's right.
Yes. So we're going to pick someone from the comments and tell us what they're going to win.
Hit it, Chris.
A free pregnancy massage.
Yes.
Woo! And we need that. Is it transferable?
Yes.
Awesome. All right. So we are going to be, and it looks like G.S. Mathis, you are winner of a prenatal pregnancy massage, and we're going to be messaging you, DMing you in your inbox. Congratulations. Thank you so much for watching. Everybody, thank you so much for being here today for the very first episode of Bumps, Babies, and Boobs. Don't forget to follow me, the Boob Boss, at The Real Boob Boss on Instagram and Facebook. Have a good night. Good night, y'all.
Bye.